Hi everyone, I'm Jomcy and welcome back to Learn with Jomcy. In today's video, we will break down one of the most important parts of the NMC OSCE, the holistic assessment. I will show you exactly what examiners expect, how to structure your assessment, and the types of questions you must ask in the assessment station. Let's get started. In the API assessment station, you are expected to complete a holistic assessment based on the patient needs. This means you must explore four areas: physical, psychosocial, spiritual, and sexual aspects. To do this effectively, you must read your scenario carefully, pick out the key symptoms, concerns, or hints related to these four domains. Your assessment should always be relevant to that patient and that scenario. Next, let's look at the patient's physical needs. Start by understanding the main physical complaint. What brought them to the hospital today? Explore the onset, the frequency, what makes it better or worse, and how it affects their daily activities. Then, check the common physical areas such as sleep, appetite, weight changes, bowel or bladder habits, mobility, and their ability to manage personal care. Always remember that your questions must always relate to the symptoms provided in the scenario. Here are the core physical assessment questions you may ask. Begin by exploring the patient's physical complaint. For example, can you tell me more about what brought you here today? Follow up with onset and progression questions like when did this start, or has it been getting better or worse? Then exploring mobility and safety, you can ask, do you need help with moving, standing, or using the bathroom? Okay, how has your appetite been? How much do you drink in a day? Have you lost any weight recently? Is there any constipation, diarrhea, or urinary problems? Finally, ask about sleep and daily living. Are you managing your personal care as usual? These questions show a complete and organized physical assessment. For example, if your patient scenario indicates poor appetite or malnutrition, focus deeper on food intake. You can ask, how many meals do you have in a day? How much of your meals are you able to finish? What type of food do you usually eat? Have you lost any weight in the last 3 to 6 months? Are you able to cook and prepare the meals yourself? Also, check for social factors. Do they have support for shopping or cooking? This helps you identify the risk and plan the safe interventions. Next is the psychosocial assessment. This section explores how the patient is coping emotionally and socially. You could ask, is anything worrying you? Have you been feeling low or anxious? Would you like to talk to someone about it? If the patient expresses low mood or anxiety, always check for the safety. Okay, this shows the examiner that you are prioritizing the mental well being as well. In the spiritual assessment section, you can include beliefs, culture, religious practices, or anything that supports the patient's emotional well being. Okay, look for the clues in the scenario. That is most important thing. Do they attend church? Do they have any dietary restrictions? And ask questions like, do you need anything to support your culture or spiritual beliefs? Is your illness affecting your faith or well being? Would you like to speak with a chaplain or a spiritual advisor? This shows person centered care and respect for the patient's values. The sexual domain is often brief, but it's important. You must approach it with sensitivity and respect. Look for the information like marital status, partner support, or relationship dynamics in the scenario. Okay, and you can ask in a gentle way, for example, is your current illness affecting your relationship? Or do you feel well supported by your partner? Or you can ask like, who are the most important person in your life? Okay, if there are any concern, okay, offer them privacy and keep it brief and follow safeguarding policies if need. Here are some essential tips for the success. First of all, leave enough time to complete the holistic assessment. Spend about 5 to 7 minutes on the holistic assessment after your initial checks, like your A2E assessment, and read your scenario thoroughly and identify the key and relevant informations. Okay, address what is most important to the patient, respecting their preferences, needs, and cultural background. Okay, look for the health promotion opportunities like smoking, alcohol use, or diet. Listen actively, acknowledge the patient's concerns, and offer supportive suggestion. Okay, if the patient is complaining about a poor appetite or malnutrition, you want to offer help to overcome that situation. For example, oh, I'm so sorry to hear that. Don't worry, I'm here to help you and support you. We'll plan your meals based on your preferences, and definitely I will refer you to the dietitian. They can help you. Like that, you can give supportive suggestions. Ensure all four domains: physical, psychosocial, spiritual, and sexual aspects are covered, and keep your language simple, clear, and patient friendly. Ask open questions related to each area. Remember, examiners want a focused, not a lengthy assessment. Thank you for watching this video on holistic assessment for the NMC OSCE. If you are preparing for CBT or OSCE, join Learn with Jomcy for structured training, updated materials, and expert guidance from UK based nurses. For classes and enquiries, please contact us. See you in the next video. Thank you.